Hello, thank you for joining us. I will be talking with Amelia Goodyear and Steve Nelson from Amicus next on the St. Paul Forum. Thank you for joining us on the St. Paul Forum. I'm speaking with Amelia Goodyear and Steve Nelson from Amicus. Welcome.
Thank you.
So tell us a little bit about Amicus first before we jump into the real meat of our discussion, which will be the girls' study. So tell us a little bit about Amicus, if you will, Steve.
Sure. Amicus is an organization that works with offenders, ex-offenders, and juveniles in the criminal justice system. And it was started in the late 1960s, and it's been around for quite a while now. Mm-hmm. And it was essentially started as a situation where we were basically understanding how important it was when people were going through the justice system to reconnect them with community. Mm-hmm. So we're really closely based around the restorative justice practices, and essentially just bringing people back into the community. And we have several programs that are working with that, and one of them is the program or the area that Amelia works with, which is she's our Director of Youth and Mental Health Services.
Oh, okay.
And we have a Radius program there, which is working primarily with juvenile girls.
Sure.
And that's where, at least partially, I think, where the Amicus Girls Study came from.
Okay. And just give us a little background. What's restorative justice?
Ooh, all the good questions. Restorative justice is, let's see, we ask this question in interviews all the time, and I should be able to answer it really well. But basically the belief that when a harm has been committed, so when someone has committed a crime, then they're harming a relationship, and it may be a relationship with another person, whoever was the victim of that crime, or it may be the relationship with the community, or just in general with society, depending on the nature of whatever was done. Restorative practices focus on repairing that relationship. So bringing the person who committed the harm together with maybe the victim, maybe the community, to have an opportunity to build a stronger relationship. And so with the restorative justice framework that sort of pervades all of our programming, you can see it really clearly in our one-to-one mentoring program, where we pair volunteer mentors from the community with inmates, and then they act as essentially a friend to be with that person through their experience while they're in prison, but also through their experience returning to the community. So they have a mentor, a guide, a role model, someone else who they can just kind of rely on for support, and that brings the community back into the life of the offender.
Interesting, yeah. And you talk a lot about relationships at Amicus and in all your programming. So that seems to be a really important pillar for your work. Talk a little bit more about what does a relationship mean to an inmate or to an ex-offender?
Well, one thing, whenever anybody asks that question, it brings to mind something that our Director of Adult Transitions, Russell Ballinger, a story he told me, related to the one-to-one program in this case. But it was a situation where someone who was inmate at Stillwater Correctional Facility actually asked Russell if he could meet them. And the main reason was that he had never been, in 17 years of incarceration, he had never been to the visitor room at Stillwater Correctional Facility. He hadn't had a single visitor during that entire time. Correctional facilities are about helping people transition back into the community in a positive way. At least that's how they were originally designed.
Sure.
And so from that perspective, without positive relationships, without somebody to model what great citizenship looks like, what getting along in society on a day-to-day basis looks like, how can you succeed? And so really relationship-based programming is really what Amicus is built upon.
Yeah, yeah. And another pillar, two other pillars that I noticed were that you do culturally specific programming. Mm-hmm. And you do outcome-oriented programming. So to share a little bit about both of those two pillars. So the culturally specific, what's important about that?
One of the things that we try to do to be more culturally specific is to find people who can work as staff at Amicus who come from the communities that we're serving. That can be very challenging because there's not, we're working with girls who are on probation in the Radius program, and so it's hard to find someone who was on probation as a juvenile and now has a master's degree in counseling or something and is ready to come back and work with juvenile girls who are on probation. But we try to find as much as we can people who are from the community, people who look like the girls that we serve. Most of the girls we serve are minorities. Most of the adults we serve are minorities. So we try to find a match in that way. And I think, in addition, in the programming that we do, we don't just kind of use whatever comes off the shelf in our groups. We really try to work to figure out what's the experience of these girls like. So our St. Paul girls have a different experience than our North Minneapolis girls.
Sure.
And I do a group in Dakota County, and those girls have a very different experience down there. And so we have to really adjust based on who we're serving. What was your other question?
And the outcome-oriented. Yeah.
Well, outcome-oriented programming is a really big buzzword for a lot of organizations these days, but it comes down to the common sense aspect. It's like what you're trying to do in this case is make sure that you're having an impact on whoever you're serving, and making sure it's a positive impact. In every case in Amicus, we work to make sure that we're measuring what we're doing. In a relationship-based service, that can be quite challenging at times. But
yeah, I was going to say, what kind of outcomes are you looking for? Clearly public safety, but what else?
Well, and it might be, in some cases, development of trust. Situations where people will report that they can talk to each other. Sure. And it's a lot of qualitative evaluation in that case, but it's it is something that allows us to really determine whether the relationships that we're hoping for are actually being made.
Sure. Okay.
We actually there was a graduate student from the University of St. Thomas who did a study with some of our surveys that we do at the end of our group to see was there a correlation between kind of the relationship aspect. So we asked questions like, I feel like I have a connection with my Radius staff, or I feel like I can talk to my Radius staff is there for me, and things like that. And she found that there was a strong correlation with the relationship piece of the program and some of the outcomes for the girls. So I think we look at some of those more process outcomes, but we also, of course, look at recidivism. Sure. So are the people that we're serving, going back to prison? Are they going back into detention? Are they getting new offenses? And
sure. Yeah. And how are your recidivism rates then?
In our one-to-one program, it's the typical recidivism rate for somebody coming out of a Minnesota correctional facility is about 40%.
Wow.
Yeah, it's really high.
Yeah.
But that's nationwide. And situation with our one-to-one program, we've gotten it down to really about 15 to 20%.
Wow, that's amazing.
Well, it really shows the power of relationships. There's a lot of different things that people have to have in order to not recidivate. From an adult standpoint, you need a job, you need housing, but you also need people who care about you. And that's been key in the evaluations that we've found. It's not just one magic bullet. It's a whole bunch of things that need to happen.
Sure. So when we think about inmates and ex-offenders, we think a lot about males.
Yeah.
But surprisingly, there are quite a few females, and it seems to be increasing. So what led you to do such an in-depth study? The girls' study is 70 or more pages long. There's a lot of information there. So first of all, what prompted you to do a study on girls?
Oh, well, Louise would be able to give you a very nice response. That's our president. But as far as, in the girls' study, just to put it in some context, I started working at Amicus over 3 years ago, and when I started working there, they had started the girls' study, and we just published it. Last spring, so it took a long time. It took a lot of work. The question that was initially sort of posed was, what is happening to the girls in Minnesota. And the girls' study was really an attempt to answer that question. So we had been doing, I should back up maybe a little bit, starting in 2000, I believe it was, Amicus was asked to provide some services for some gender-responsive services for girls who were committed to the state, who were on probation. And so Amicus put together this program in connection with the Department of Corrections. Am I right about that? Sometimes we have all these different partners. And so we served, with a very strong restorative justice component, we served the state commit girls. And then at the time, I think they were somewhere up north, and then they moved to Woodland Hills in Duluth. But then a few years later, Ramsey County approached us and said, hey, can we do something more local for the girls who are, just our county girls? So then we started working with girls. So that's how we got into our gender-responsive programming. So at the time when we were looking to the girls' study, the question really was, what kinds of services are girls getting in the state of Minnesota, regardless of what county they live in? Are they getting the kind of gender-responsive programming that I think, that the experts know they should be getting, but is that really what's happening on the ground?
Okay. And what did you find then?
Well, we found, I think, what to me is really interesting about the study, because our approach was we did a bunch of focus groups. And we did focus groups with girls, we did focus groups with parents, and we did focus groups with professionals that work with girls. And what we found, so our goal was really to get the voices of the girls, of their parents, of the professionals, of the people who are living this experience of what is happening with the girls in Minnesota. And what we found was that what was being said was actually very similar to what you see in the literature in terms of what the girls wanted and needed. So the girls were saying, we need our families to be involved. We need to, see people who we can trust, who've had the same kinds of experiences that we have. Parents were saying we needed someone to intervene 5 years ago when my daughter started getting in trouble, and not waiting until she's, being placed somewhere in another state. And professionals are saying, we know that there's more we can do, but we need time, we need training, we need resources. So there were a lot. I can kind of go through if you want by the different groups of people, but there was a lot that we heard. But I think what was interesting was that the girls were really saying much of what we see in the literature. So we've had a lot of negative experiences and struggles in our lives. We need people we can trust. It's hard for us to trust people. Things like comorbid issues like chemical dependency, so a lot of the things that are going on, needing health care, being young parents themselves.
Sure. And there are some significant disparities that are apparent between the genders in our juvenile justice system, it seems like. So that the youth, the girls, are experiencing very different kinds of experiences than the boys are. More sexual
more sexual assault,
maybe,
maybe,
I was reading the report, a little bit of it, and I was just floored by some of the data about what the girls are going through. So then how does gender responsive treatment address those kinds of experiences that are different from the males?
Sure. Well, first of all, I would say, I can't remember exactly the statistic that we have in the report. I think it was 70 or 80% in terms of the number of girls who've experienced sexual abuse or different kinds of abuse before coming into the system. Now, I want to emphasize that boys also have those experiences, so it's not just girls, and I think maybe it's more underreported in boys, but girls are, according to the literature, more likely to have had some of those experiences. So that's one of the important things, is that gender-responsive programming really be centered on that trauma that has contributed to a lot of the behaviors that are getting girls in trouble. So one of the things that's different, I think, about girls is that some of the pathways into detention can be different. For girls, a lot of times they're getting in trouble for things like running away, which is often a coping mechanism, trying to get away from something that's a really negative experience at home. Girls tend to be, I think, a little more likely to be criminalized for something like running away because we worry about girls if they're gone. So that's An example, I think other coping mechanisms, self-harm, chemical use. So some of these things that girls are doing in order to cope with some of the negative experiences in their lives can end up getting them in trouble. Fighting can also be a coping mechanism, and a lot of our girls actually come into probation because of fighting, and oftentimes it's at home fighting with mom. So as far as being gender responsive, being aware of all of those things, but girls don't really respond well to sort of punitive kind of programming. Girls are very relationship-oriented. So when you asked about the relationship-based programming, it's very important that we, even as a counselor, so my background is in social work, and it's a little different from a lot of what I learned in school to come into a therapeutic relationship focusing on, first, we're going to build a relationship, and then I'll worry about what's your diagnosis or what's all this other mental health stuff. So we really try to make a connection with the girl so that she has someone she can trust and someone she can talk to.
Sure.
So it's less about cognitively, okay, I'm going to teach you what's right and what's wrong and how to make decisions, and more about we're going to create an environment where it's safe to talk about the negative experiences that we've had. And then out of that, there will be a healing experience, and then those negative experiences from the past won't affect the future and the present as much anymore. So that's kind of my little spiel on gender-responsive programming. Also, sexual health, very important, I think, especially for girls, because girls get pregnant, girls are very vulnerable to a lot of STDs, so we have to have that component in there, too. And I think something that came out in the study, too, was this need that there be more of a health piece to some of the programming for girls, so that part is being addressed.
And so do you work closely with the other agencies to get them health care or appropriate health care? Talk a little bit about the health care aspect of
what we do is we'll try to bring in other providers from the community into our group to do kind of a presentation on what they can offer. And so there's a lot of clinics where girls can go, and we'll also take them there if they need to, but try to get them connected with some of these resources in the community.
Sure.
So like Family Tree Clinic, we often bring them in to talk to our girls. They actually even detention brings them in anyway, so a lot of the girls know those providers. But we want to make sure that they know where the resources are in the community, and how we'll help them get there, but how they can get what they need.
So your girls program is relatively new. How old is it? The Radius, starting with Radius, is it? And then...
Yeah, so the Radius program, well, the first one, for the state commit girls, that was in 2000, and then the program here in Ramsey County, we had the community-based program. I think our first, I'm just thinking about when we have our outcome data for it, was 2005. But I think they started in 2003. Maybe I'm getting my dates a little wrong. I should have looked that up.
That's all right. We'll send everybody to the website. They can see the timeline.
Go to the website for the exact dates. But then the juvenile detention program, that started a little later. So that started a couple years after that, and then we started some programming in Hennepin County. So now we have programming actually as of September throughout Hennepin County.
That's great.
So we've been in kind of a constant state of expansion.
Okay.
And it's actually the fastest growing program that in Amicus, and I think that's at least partially because people are very interested in making sure that that we're working with girls in the correct way. I think that there's there's a societal idea that this is a group that society wants to make sure doesn't fall through the cracks.
Yeah, that's great. If you're just joining us, I'm speaking with Amelia Goodyear and Steve Nelson of Amicus. Let's go back a minute to some of the coping mechanisms that you were talking about, Amelia. And one of the things I noticed in this study was this word called bootstrap. And so tell us a little bit about what bootstrapping is and how that relates to the coping mechanisms that girls display.
Bootstrapping, do you have a definition for that one?
I can't really tell you for sure.
It's kind of
I'd have to look at it.
Awkward, but what I get from that is that it's sort of a way of keeping girls in the system in order to get services. that they need that really aren't related to detention, to public safety so much as their own health and human needs.
And I was thinking, I know I said the word bootstrapping, and I think
it was an older. I didn't realize it had come out. The report had come out in spring. So you're allowed.
I'm allowed. Well, I was insisted that Steve be here because he really wrote most of the words. But
not most, but it's
sure.
I think in that area it's actually part of the history of.
It is.
Yeah, and it's a situation where the Department of Corrections and other agencies were getting involved at that point, and it's something that was very big in the in decades past. It's less something that we run into right now,
But to answer your question, though, because you do see that still, it's hard to answer because what's really coming to my mind right now is an example of a girl that I've had in the group in Dakota County for almost a year. And so that group is structured a little differently. And she just doesn't want to get off probation. And so we see that so many times where really girls will say, I'm worried about getting off probation because I won't have this sort of guiding force in my life. Now, is that appropriate that we have girls who have to have juvenile criminal record and be on probation in order to get support?
Exactly.
I don't think so. However, I'd say, I know a lot of the POs in Ramsey County because I've worked closely with all the POs here, and we have a set of really dedicated, talented, loving, caring people who are really trying to be supportive and helpful in the lives of these girls. Sometimes that means that you are faced with the choice of, do I discharge this person from probation knowing that this is a situation where, child protection is not going to intervene because she's old enough where it's kind of like she can take care of herself, or do I keep her on just so that she has someone else involved in her life and kind of monitoring? So I think it's a sticky situation, and I think sometimes that is a way to get some services. And I don't know what to say, because I think it's until we have a system where, and this is something else that came out of the study, we really need to be focused on prevention. Until we have a system where you can get services because you're starting to struggle, then I would like to see girls get services however they can. But then, you don't want a juvenile felony on your record because that can still affect your future.
What kind of job are you going to be able to get? Because employers still do not want to hire anyone who has who's had a record.
And nowadays, especially with juvenile records, with the age of Google, the internet, it's a situation where it's very difficult. Even if you've gotten, even if your record is sealed, it's very difficult to leave your past behind.
Yes. Somebody catches you on Facebook.
Yeah, that's it. One thing that's also pretty interesting, I think, and that really hit me as we were going through the girl study was just the differences between how boys enter the juvenile justice system and how girls enter. Amelia touched on it in terms of the fact that girls will often go through significant trauma, internalizing it, taking it in. Before acting out to the point that the justice system recognizes them. A boy is more likely to respond to something, some kind of trauma with violence almost immediately.
Sure.
And the justice system, in many ways, seems to be connected toward, geared toward responding to somebody responding like that. And I think that's one area where I think we can really do girls better service than we do.
Sure. So one of your recommendations was in the report is to focus on prevention. What are a couple other recommendations that come out of that report?
Well, so we have, we really want to make sure that, I don't remember how this was worded exactly because we reworded it so many times, but
wordsmithing, oh no.
Basically making sure that that the law is really being enacted. So the law about girls getting equal share of, I think, resources and services. And so that means, making sure that there is training provided and resources provided for these programs so that girls throughout the state can get some good quality gender responsive programming. And I think it's important to emphasize throughout the state because this is, you know, in the Twin Cities we have a lot more resources than in other counties.
Yeah, that's one of the things we found is I think that that in doing this study throughout the state that it was wildly inconsistent. I mean, there was some situations where people would have very commendable programs. Some situations where the programs may not have been there may have been significant improvements to be had. The other piece on that is just the data. In some cases, we might know a lot about a set of girls that have been worked with, but in other cases, we might know very little.
Sure.
And
that was another recommendation that we had. Keep track of the girls, basically.
They need data,
which is hard. But would be because the original, question, what happens with the girls? If everyone had some kind of database, and we made a number of phone calls to find out, how can we get the information on where the girls are going in your county? Right. And basically, we were told that you can't get that information. It's not really being kept in a way that can be shared, and it's hard. It's very hard. It's a lot of work. Our partners at Ramsey County are super busy, and they had to work really hard to get us all this recidivism data. So, and there's all these other programs that need it too.
Yeah. Well, data is helpful for everyone, I think. So it's not that it needs to necessarily go to just your program. It can definitely be used in other ways. So it's a good investment.
Yeah, and I think one of the things that we also really noticed. Through the study, Minnesota is a leader actually in working in the juvenile justice system, especially gender responsive. We've had some real pioneers in that field, really over the last 50, 60, 70 years. And it's interesting because I think in many cases, our professionals know what needs to happen. The question is, can you do it consistently? How do you implement it? Can you get funding? Situation where laws have been passed in terms of appropriations at the state level, and then 2 years later, when the attention was on something else or budget cuts got hit, those laws sort of fell under, and new appropriations weren't brought in.
Sure.
From that perspective, I think the state, in some cases, wants to do the right thing, but it needs the resources to continue doing it.
And that might be a place where data helps too, because if you can't prove something's working, it's a lot harder to get the funds and resources for it. We have 1 minute left. So what is next for Amicus from this study?
Wow.
So we'll take you 1 minute to talk about that.
I mean, at this point, we're really trying to share what we learned and make sure that the word gets out. What are your plans beyond that, Steve?
Well, I think that is the idea. I think the biggest thing right now is that we want to make sure that that the information that we had, we didn't talk about the fact that a lot of the information that we have here is about the girls talking as part of this too. They want to be heard.
Right.
They've indicated some specific things. Treat me like a human. Talk to me. Involve me in the plans as much as possible. And I think that's one of the key messages that we want to get out there as the future goes. And there's a lot of organizations that we're working with. I think the biggest thing right now is to just sort of spread the word that you might have known this, but maybe somebody else didn't know it.
Right,
maybe as you start building cultures, you can start bringing in, new staff that have new knowledge, and we can make the progress that everybody wants to make.
So we can do our part by having our viewers make sure to read the report, and the website is on the screen for our viewers right now. So we'll say thank you so much for coming and sharing this information. And Steve Nelson and Amelia Goodyear, thank you.
Thank you.
Thank you.
And thank you for joining us on the St. Paul Forum.